The focus here now is, how do we provide care in a post-COVID world? How do we do the things now in a better, safer, more effective manner that we couldn't do or that we didn't do before? And I think that telemedicine is a big part of that.
How can we expand care to patients? How can we make broader services available through the use of technology?
Neurology is a service that we have provided in the past and we need to continue to provide in the future. So it's very important for us to build that rapport and that trust with our community, for the services that we are able to provide here at National Park Medical Center. Part of the reason we reached out to access telecare for inpatient neurology was because we didn't have consistent coverage for neurology. We want to provide comprehensive care here for our patients.
Any delay of care can impact quality and ultimately the safety of the patient. So we feel this is a very good fit. It's timely, it's quickly available, readily available. The interaction is concise and complete and good.
There's nothing more frustrating for a patient than to come to their local community hospital, come in through the emergency room, and then be told that we're going to have to send you somewhere else. We would have patients come into the emergency room that needed neurological services that we couldn't provide, or we would get a call from a smaller facility in an outlying area that needed inpatient neurology services, and we didn't have the ability to provide that. We serve a wide population. We serve the Hot Springs proper, of course, but we also serve as a hospital that takes referrals from outside hospitals. And so if we don't have the ability to provide a certain service here, then that's detrimental to the patients in our primary and secondary service areas. We want to be able to keep patients here in the hospital, be able to, provide the neurology services, and then also to accept those transfers from the smaller facilities that don't have it.
There's nothing worse for a healthcare provider to know that a patient needs something we can't give them. And so if we have a patient here that needs a neurologist consult, we want to be able to provide that. It's an important part of their complete care. And if we have to transfer them to another facility in order to receive that, I think we feel a little bit bad about that. We know it will provide faster, better care, more complete care for the patient. It will keep them in the community, and it will help us get the patient to their next destination in a more timely fashion.